Cardiac illness related to coronary arteries are caused due to blockage of blood vessels which supply fuel to the heart. When these blockages occur, they can cause either chest pain when we exert, if it's a partial block. If it is a sudden block which is complete, then they may cause a heart attack. Depending on the area involved, the heart attack could be fatal, or you could reach a hospital in time for treatment. So these blocks are nothing but plaques. These plaques contain fat and calcium in various compositions along with other components. They start developing very early in life and continue through life. So the rate of development of these plaques or blockages is what determines when we develop heart disease. You may see that some people live to a long age without heart disease, whereas others develop heart disease at a very early age. The rate of development of these blockages depend on various factors. Some of the common ones which have been kind of investigated and understood are diet. So someone who has a high carbohydrate, high cholesterol diet and has poor lifestyle in terms of lack of exercise, excessive smoking, stressful environment, lack of sleep, diabetes, and of course, importantly, those who have a predilection due to family history or genetics. These people develop plaques earlier and they present earlier as partial or complete blocks. To be honest, there isn't any perfect mantra that I can prescribe to you. You find on one hand some people indulging themselves in plenty of food, wine, and various so-called vices, but who live a good life. Whereas those who have never smoked, never eaten non-vegetarian food, or have been very strict in life, end up with heart disease early in life. The common simple advice guidelines would be that if you have a family history of heart disease, whether you're diabetic, you're smoking, or you're obese, or have an unhealthy lifestyle, or have had dear ones, first degree relatives with heart disease, start evaluation or checks earlier on, maybe 30, maybe 35 years of age. Get a check once a year or once in 2 years initially. The standard checks would be blood tests to look for diabetes and various other health issues. These are routine blood tests. Get an ECG, an echo, and what we call as a treadmill test or a stress test. This test puts your heart to stress and sees if there are any ECG changes which are brought about due to blocks and lack of supply to some areas of the heart. This is a simple test. These are all non-invasive, and most often these tests are able to pick up significant heart disease. It is not absolute. It doesn't pick up 100% of the patients who have heart blocks, and therefore it is important for one to keep an eye on symptoms that one faces when one exerts, climbs stairs or climbs a hill or exercises, and to do these tests at regular intervals. So one may experience chest pain, discomfort in the chest, shoulder, jaw, left arm, or sometimes, which is often missed as acidity, is symptoms similar to acidity. Indigestion, discomfort coming on with sense of feeling of being uncomfortable, uneasy, lightheaded. These could actually be signs and symptoms of a block in the heart vessels or an ongoing chest pain or related to heart attacks. Often these symptoms mimic that of acidity or gastritis, which most of us end up taking antacids and delay our assessment. We delay going to doctors and getting our ECG or checks done, and valuable time is lost. Why is it important to get assessed as soon as you have symptoms? Symptoms of chest pain, discomfort, or vague sense in the abdomen or chest are signs that you may have blocks which are significant, causing reduced blood supply to various parts of the heart. The heart cries for help. It is important that we do not ignore that cry. It is important that we see a doctor and get ourselves evaluated. If all is well, so be it. Enjoy your life. If there are issues to be concerned about, further tests will reveal the problem, and there are good, reliable solutions for this. Yes, definitely we are seeing more heart disease and illnesses in the 30 to 40 age group. The reasons could be twofold. One, that we are evaluating more people are getting checked, and we are able to diagnose them more frequently than it used to be in the past. And second, of course, is the fact that heart disease has increased among the younger population. The common cause for this is the increasing frequency of what we call as metabolic syndromes or metabolic diseases. The way our body deals with carbohydrates and fats and various foods, the increasing incidence of diabetes among younger people, increased incidence of obesity, compounded by increasing economic ability to purchase high-calorie diet and the fast foods that are available easily. And of course, the lifestyle of high stress, running around without a break, without knowing what really matters and what is more important. All of us are in this rat race, and we fail to give our bodies adequate rest, sleep, and exercise. So, in a nutshell, the incidence has increased, both because it is being recognized earlier and more often, and because of the current lifestyle and increasing diabetes and metabolic syndromes among younger members of our society. So this is definitely a wake-up call. None of us are immune from heart disease. It has been there, it will be there. All of us have to put our minds together without panic to have a sensible way to deal with it.
If you like this video, please like, share and subscribe to our channel.